This is Zach. Like more than 46 million people in the United States, Zach isn't eligible for Medicaid or Medicare and doesn't have insurance from an employer. Like the others in his situation, Zach is stressed. It's not that he doesn't have insurance, he does. He pays $300 a month for the Silver plan he bought through the Affordable Care Act insurance exchanges, but he's still stressed about the copays he might be responsible for, and his deductible, which is more than $3,500. Zach has $1,200 in the bank, for now. After his rent and car payment are due on the first of the month, he'll need to use all of his paycheck and some savings to pay his bills. It's the same every month. This means Zach decides not to go see a doctor, which only ends up increasing his future medical costs. And if something goes wrong and Zach really needs to use the healthcare system, he has no way to pay his deductible. That's stressful and confusing, and Zach isn't the only one stressed about healthcare costs. This is Sally. Sally has been ill for the past 2 years with a very serious form of cancer, as well as lupus. Sally's medical care costs more than $350,000 annually. Sally makes $24,000 a year and pays for a silver insurance plan under the ACA. After her cost reduction credit, her insurance costs $140 per month. Sally has a deductible of $700 and a maximum annual out-of-pocket limit of $2,450. In total, she pays about $340 per month, or $4,080 annually. That amounts to 17% of her annual gross income. Though Sally is far better off than those without insurance, her medical expenses place a considerable financial burden on her and her family. This adds more stress to Sally's already very difficult situation. We think of insurance as something that protects us, but more often than not, dealing with insurance is stressful. In fact, more than 41% of personal bankruptcies are caused by medical expenses. So if insurance doesn't really protect us, why is healthcare built around insurance? We thought about this question and came up with a new one. What would a healthcare system for 46 million uninsured Americans look like if insurance didn't exist? First, we need to look at the costs of our current system for those 46 million Americans. When you add up insurance premiums, copays, deductibles, non-reimbursed expenses, and billing and administration expenses, you end up with a system that is far more expensive than the actual cost of healthcare. Now think about what would happen if we took insurance out of the equation altogether. Without insurance, the cost of healthcare would be equal to, well, the cost of healthcare. Without insurance, we could all buy the healthcare we want or need. Instead of giving our money to insurance companies and then fighting to get it back to cover the cost of care, wouldn't it cost less to just buy our healthcare directly? Of course it would. But how would we pay for it? It's called self-pay guaranteed. Unlike a single-payer system where the government pays for medical bills, under self-pay guaranteed, individuals pay for their own care, but can borrow money from the government to cover any costs they cannot afford. The government will already guarantee a loan for your house, your tuition, your small business, and plenty of other things. And with some of those loans, the government only requires individuals to pay back what they can afford. This is called means-tested repayment. Why couldn't our country guarantee loans for healthcare in exactly the same way? Think about Zach. Let's put that insurance payment back into his bank account. Now Zach has an extra $3,600 a year. He can put it in a tax-free health savings account, or save it, or, knowing Zach, he'll probably just spend it. But if Zach ever needs healthcare, he can walk into any provider, pay a $25 copay, and pay his balance directly, hopefully with the money he saved. He can get the same prices that the big insurance companies negotiate using our reference price list, or find the best price on his own from an approved healthcare provider. Under self-pay guaranteed, if the total cost is more than he can afford, providers can still charge Zach for the cost of care and get paid within 30 days. Even with her chronic and expensive medical conditions, Sally has the same opportunity. She pays her $25 copay, plus what she can afford to pay on a means-tested basis. In addition, due to the very expensive nature of her disease, her annual total out-of-pocket cost is limited to 5% of her gross income. In Sally's case, $1,200 per year. This cost is dramatically lower than current ACA costs for lower income individuals. Because of her income level, any of Sally's unpaid healthcare expenses will be waived after 15 years, and she is also eligible for reimbursement of all of her out-of-pocket expenses. These reimbursements are possible due to the estimated $400 billion the government will save over 10 years with the Self-Pay Guaranteed program. Whether it's Zach or Sally, getting care is easy. Providers simply scan patients' driver's licenses or state IDs and check a box for approval to determine their income through the IRS and bank account levels for direct debits. At the end of the month, patients get a statement, just like a credit card bill, that tells them how much they owe that month based on their current income. It could be as low as $25 or higher, depending on a formula that will range from 5% of annual income for the lowest income participants up to 20% at the highest income levels. And remember, lower income individuals like Sally have the opportunity to have all of their out-of-pocket expenses reimbursed. Under Self-Pay Guaranteed, all healthcare expense data also goes back into the system, allowing us to search for fraud and find ways to make improvements in healthcare delivery and personal wellness. This also means we can publish pricing and rate providers to make consumers and patients better informed and healthcare markets increasingly competitive, even in small markets. Even better is the fact that based on non-dynamic scoring from a progressive economist, Self-Pay Guaranteed will save consumers and the government each more than $40 billion every year. With this $800 billion savings over 10 years, not only will people have the opportunity to get healthcare and stay healthy at a lower cost, but the savings can also be applied to reimbursements for the neediest of our uninsured citizens. We can also use these savings to expand coverage to include services currently not available under the ACA, and to extend wellness programs that prevent and preempt health problems. Self-Pay Guaranteed reduces costs throughout the healthcare system, while ensuring affordable and improved care for all Americans. Does this program replace the exchanges created by the Affordable Care Act? Yes. Why wouldn't individuals just stop paying their bills? Because the payments are means tested, individuals could owe as little as $25 a month. Plus, everyone realizes they will need healthcare at some point in their lives. By not paying their bills, individuals risk losing access to their care. What if an individual has an expensive procedure that they will never be able to pay off? Individuals will need to make payments monthly based on the system's calculation of what they can afford. With payments as low as $25 per month or 5% of their income, we feel this is more reasonable than requiring people to pay insurance premiums for their entire lives with the constant risk of losing coverage after one missed payment. In addition, balance is still in place after 15 years will automatically be waived. Will this program negotiate discounted pricing for drugs? Yes. Similar to the way we will negotiate with healthcare providers, we will negotiate with drug manufacturers to get the best prices for patients and reduce the net cost to participants. Will every provider be required to accept this program? No, but we expect that most will. For providers, accepting this program is as good as cash, because they will be paid consistently every month. In addition, the reduction in administration costs will incentivize participation. Can individuals get their prescriptions refilled automatically? Yes. Using the data from this program, we can work with retailers and pharmacies like Walmart, Sam's Club, and Amazon so that patients can have their prescriptions filled automatically at the cheapest source. Can anyone choose to have expensive or elective care even if they know they can't afford it? No. We will use Medicare's guidelines as a starting point to define acceptable usage of the program. Could individuals purchase insurance using this program if they wanted to? No, insurance would not be an eligible purchase under the Self-Pay Guaranteed program. However, anyone can make the financial decision to buy private insurance should they choose to. We expect that many people will use their savings from this program to buy insurance. We also expect that the price of private insurance will decrease.